So with this title slide, social media, patients, pediatricians, and professionalism, what's everyone tweeting about, that goes over my 140 character count on Twitter, so I could just close it up here. But we'll get to that. And the objectives for the next 40 minutes or so to describe some aspects of Web 2.0 or social media usage generally and in medicine specifically, so you can understand what your patients and some of your peers are doing, maybe what your own kids are doing, what Mark's kids are doing. And another objective is that some adult internal medicine colleagues and I and some medical students that I've gotten involved, we conduct research in this area, generally online professionalism. We've done some focus groups with students. We've done some surveys among deans at medical schools, and we've collected some data from the web itself. And what we've done is propose that social media can be thought of as a mirror, and I'll discuss how, and I'll flesh out that analogy. So that's me, and this is me also. This is my online identity. I'm the ungoogleable man. Even the most powerful search engine cannot find me. Well, that's not true. If you Google me, you'd probably find me at Children's. And I'll point out that Children's is on Twitter and Facebook and MySpace and Dig and Delicious and more. So, and then also about me, I participate in a Mothers in Medicine blog occasionally. And now, so other than participating on this blog, this here is the biggest group I've spoken to. So this blog is now 2 years old. But enough about me. Who are you online? Who are you representing when you go online? Are you representing just yourselves? Or are you representing your practice? Are you representing the entire pediatric profession? Are you representing all of physicians? You know, so these are some tough questions to answer, but important to ask. When you look in the social media mirror, what do you see, and what are other people seeing of you? So kind of speaks to what is your digital identity, or also called your digital footprint. So is it your personal or your professional identity, and can you possibly or should you keep the two separate? Social media is blurring our personal and professional online identities, and you know, you use social networks to stay connected to other people, but unprofessional posting, unprofessional behavior could harm your career. This was yesterday's fire here, I think. There was a fire alarm and all, right? So you want to be comfortable using social media, right? And you want to know what your patients and your colleagues are up to. So let's go over some definitions. And Web 2.0 is just an umbrella term for all of these user-generated, web-enabled applications that the users put information on there. The users, that's you, the population at large puts information up there, and that could be wikis, blogs, social networking sites, podcasts, things like Facebook, MySpace, Second Life, Flickr, YouTube. And the growth of the internet as an interactive real-time communication tool has allowed Web 2.0 to become the 1 millionth English word. That's per the Global Language Monitor, and that was actually a year ago. It was designated that way. So in terms of some definitions, have you heard of blogging? So blogging is posting. It's like putting your journal online. It's making an online diary or putting commentaries up online where others then can respond and post comments for anyone online to see. And then microblogging is doing it in a small way. It's doing it where one of the most common places to microblog would be on Twitter, which is where you just send 140 character messages to all those who follow you. And you would have a handle or a name on Twitter, and then they're called tweets. I just heard that the New York Times said we shouldn't be using the word tweets. That's a made-up thing, but it should be posting on Twitter. But that these are publicly available and these are searchable on the web. And a wiki, has anyone heard of a used Wikipedia? You know what the word wiki means? Anyone know? Or what it comes from? It comes from the Hawaiian word for fast, or it could be what I know is. And this is the symbol for Wikipedia. And that's where it's supposed to be that software that's used to create collaborative websites, and it's supposed to be easily created and edited by users, so you don't need to have all the tech knowledge to participate. And so you know when you do a search, maybe you're using Google, and then something on Wikipedia comes up, and then you ask yourself, or you have to decide, am I going to go to that to find out how to help my patient, or am I going to go to something else? The chuckling makes me think that you've been there. So, podcasts, that's digital media files, could be audio or video, and they're released episodically, made available, downloaded, posted on the web, could be on iTunes. YouTube is a video sharing site, and we'll talk a little bit more about that. And then texting, there are probably some examples in the audience right now. You can see some people doing that. It's sending a brief message from a mobile or cellular device. Instant messaging is a form of real-time direct text-based communication between two or more people. They're using computers or other devices. And sexting, I have no picture. Who knew about that? We'll talk a little bit more about that. It's like if you show me yours, I'll show you mine, something like that. But we'll talk more about that. And of course, Facebook. And there's Children's National Medical Center. It's a social networking site to share information with friends. It was founded in, anyone know? 2004. And the term friending on Urban Dictionary is the act of requesting someone to be your friend on Facebook in which they can accept you or reject you. If they accept, you can look at their page, but if they reject, you cannot see their page. So it's coming to the end of the morning, but I'm going to ask you to tell me about how you're participating. So can you stand up if you've ever used the internet? Have a mid-morning break. Stand up if you've ever used the internet. Take a stretch. Okay, so if you have a Facebook account, stay standing and everyone else can sit down. Okay, it's public knowledge here. Now, if you follow someone on Twitter, or if you are on Twitter, stay standing and everyone else sit down. And some people may stand up again. Okay, so some people on Twitter. If you've ever been friended by a patient, this may include some people who are sitting. If you've ever been friended by a patient, stand up. Okay. And if you've ever, that is the question. And what we hear is, have you accepted? So you've been friended by, but then the question is, have you accepted? And have you friended a patient? Have you friended a patient, sent a friend request to a patient? Okay, well, thank you for sharing that. So there were, one or two remaining people in the room that they have friended a patient. And, we can kind of think about and discuss, should there have been anyone standing, or should there have been more people standing? So what's going on around the country? There's the Pew Internet and American Life Project, a fabulous source of information about what Americans are doing online. They've been tracking this not just with social media, but going back to just the internet. So 61% of American adults look online for health information. And, as Ben Gitterman mentioned yesterday, Americans are still turning to traditional sources of health information, but they are also turning for online for health information. And just over half of the online queries pertain to someone else, and that speaks to what we do. Parents are looking up information about their children, or it could be, of course, they're looking up information about other relatives or other friends. And so 60% of e-patients, those who go online for health information, they are accessing some kind of user-generated health information. So that's the social media stuff. It could be that they're what that means is that 37% of all adults are accessing social media for health. So they might be reading someone else's commentary or experience about some health information, some health issues that they've had. They might be looking up rankings or reviews online about hospitals or about doctors. They may have signed up to receive some health updates or listen to a podcast. So about a third of all adults are looking up information online about doctors, and about 28% of all adults are looking up information online about hospitals. They're doing this online. So fortunately, even though online health inquiries have had an impact on people's decisions or actions, the bottom line is that they are still coming to us for our expertise. But when you ask somebody who goes online for health information about their most recent online health inquiry, and that's what some of the Pew studies did, 13% said their most recent inquiry had a major impact on a decision that they made, and 44% said it had a minor impact on their health. So where are people looking? There are many rating systems. This is a way to categorize Twitter, which really doesn't have a good categorization system. It just has a search. But you may recognize some of these docs: Dr. Drew, Dr. Gupta, Dr. Chopra, Dr. Oz. Maybe some of you, right? But let's consider, what are your patients doing online? Do you know what they're doing, and do you look, and do your children tell you what they're doing online? So there's some discussion about whether we should be finding out kind of inadvertently by being friends with our patients that they are still smoking, or that they're doing some things that they disclose to us in other ways that they are or not doing. Patients might be learning from each other. This is a site, Patients Like Me, and what it says here is the whole point of Patients Like Me is sharing. Changing the paradigm of medicine where everything is private, and learning from each other and contributing to research into our particular conditions so that others may also benefit. But how risky are social networking sites? So this was a study in 2008 by Michelle Ybarra, and they conducted a national online survey of about 1,600 youth aged 10 to 15 years who are internet users. And 15% of the survey respondents said that they had unwanted sexual solicitation online in the past year. 15% said they had unwanted sexual solicitation online. And about a third, 33%, reported online harassment, and this was often via instant messaging and in chat rooms. So this can be scary stuff. What are kids searching for? This is just from the New York Times in April this year. And so what this is saying is that they're searching for YouTube, they're searching for Google, they're looking at Facebook, and then the 7 and under crowd is looking up porn. But just to find out, what does that word mean? That's speculation. And then once they're over 8, they're looking up sex, and we can guess what they're trying to, for whatever reason. Now, if you can see in the Washington Post, they're saying Twitter is not that popular among teenagers, but they are sexting. So, I'm preparing, and you want to see, well, what would happen? And if you searched PubMed for sexting and your search for sexting retrieved no results. But there are some articles in the Washington Post where this may be familiar to many of you in the room. Some female students from Montgomery County schools posed for inappropriate photos, and some others bought access to those photos. Are you familiar with this? And had parents been coming to you with a discussion about this, what they should do? Did anyone encounter this in the office setting? Some of you have. So we'll get to some tools in a moment about how to address some of these things. One thing that the University of Texas at Houston is doing is using this public health campaign. Now, it can start very young. This might be your next nursery patient, right? So, okay, so let's get conceptual again and understand the three ways the social media mirror works. We're going to talk about how the social media mirror has no blind spots and that the mirror can distort, and then finally we'll get to how the mirror can magnify the good. So the mirror has no blind spots. Privacy settings could give a false sense of security. And how well do you really know your friends? And I can say friends in quotes. Has anyone overshared or felt that they've learned too much? Aha, yeah, okay. Yeah, you know, there's this disinhibition that can happen so quickly. You know, you just press the button, you just, you know, click, and there it is, and it's really hard to take it back. You can set it up in a certain way, but, you know, the hackers can get through, people can get through. The internet doesn't forget. There's a permanent record of the internet, so even if you delete something, it's still there. And so it could be something you've posted, could be saved, could be reused, could be recycled, it's out of date, or you're no longer doing that, but it's still up there. And you can't really be anonymous. You can't guarantee your anonymity. And you might take more risks, and having your guard up all the time is stressful. So let's see how the mirror can distort. You know, if we want to think about about practicing medicine in the age of Facebook, there's a physician in I think he's in Boston, and Sachin Jain, and he wrote in the New England Journal in 2009 about practicing medicine in the age of Facebook. And you know, we can ask some tough or easy questions, but will you Facebook friend your boss? Well, Americans said no, we're not going to do that. But some of you in the room may, or you may not think of it as your boss, right? Will you Facebook friend requests to your patient, and even so, will they friend you? And will you accept, and should there be a policy on that? Like, where should we look for guidance on that? Are you prying into your patient's their personal lives? And if you're online, do you then need to be available 24/7? And are you blurring the lines for yourself between your own personal and professional time as well as life? Can you ever be off if you're participating with social media in this way? And then will you be compensated for your time online? So unprofessional events loom large for the public, and media can play up scandals, of course, and social media spreads information rapidly. And the mirror of social media would reflect the actions of a few to the entire world, to the entire profession, and it would impact upon the public's trust. So in one instance, physicians and other health professionals who were delivering aid in Haiti after the earthquake posted pictures online of naked and unconscious patients in operating room suites. Others depicted physicians drinking or posing with grins and a thumbs up in front of their patients or coffins. You can think about what if a surgeon who's going to conduct surgery on you or your family member tomorrow, you see that they've posted on Facebook that they were out drinking today or intoxicated the night before surgery, and then there's a bad outcome. So just opening up a world of possibilities. There was a Stony Brook medical student, now a resident, who apologized for posting, again, a thumbs up. That's often the culprit. Thumbs up photos on Facebook in front of her anatomy cadaver. And it was when she was a resident that she apologized. This was in February of this year. Now, medical students can cross the line as well. And I worked with some colleagues on a survey of student affairs deans across the country, and we found that 60% of the responding student affairs deans reported incidents of unprofessional behaviors among their medical students. And so what would that be? That could be breaching patient confidentiality, Could be some sexually suggestive photos or photos depicting intoxication, profanity, or perhaps discriminatory language. And 67%, in 67% of the circumstances, they were given informal warnings, but 3 resulted in dismissal from medical school, so there goes their career. And only 38% of the schools that responded had policies to address this. So some response from the public to this article when it came out last fall in JAMA were, and I don't mean to read to you, but I like to emote. So I'm sorry, did you say these are future doctors? I think they had better wake up to the responsibility of the occupation. They will be and should be expected to behave professionally. I'm a teacher, and we have been told by our union not to post on Facebook at all. As professionals, doctors, teachers, lawyers, etc., are held to a certain standard, and if that's not your cup of tea, find a different job. So that was posted online in response to our article by a teacher. And then from a lawyer, these kids are med students. They will be in charge of literal life-altering decisions, yet cannot be burdened with common-sense life choices on their own. We should hold these young adults to a higher standard. We must hold them to a higher standard. And then an anonymous posting, medicine is a very serious profession, and medicine right now is teetering on the edge of respectability and trust in some areas. Soon there will be so little trust that it will undermine the respectable people who've chosen this profession. Most of these occurrences seem to just a case of common sense. I expect to have a medical student who is mature and not reckless, which this is. So let's turn to the good. Social media, the mirror of social media, can magnify the good. You can build community. You can advance professional networks. Is anyone on LinkedIn? Some of you, a few of you. So LinkedIn is used by more than 65 million professionals. It's not just limited to health professionals. And what they try to do is entice professionals to control your professional identity online. So this is a way to have a social media site that you've created for yourself that depicts your professional life. It's an attempt to keep professional separate from personal. Sermo is another. Is anyone familiar with Sermo? So this was founded in 2006. It's open only to DOs and MDs in the United States, and their physicians would post observations and Q&A about clinical issues. And it actually doesn't advertise directly to its users, but it does sell access to physicians' anonymized comments and polling data to financial institutions, to healthcare organizations and governmental bodies. It had been partnered with the AMA, but no longer. So social media can also be used for advocacy. Many pediatricians consider themselves advocates, right? So we can share sound information, we can promote good causes, and there's a big discussion about whether physicians actually have an ethical responsibility to be present on social media, to ensure that accurate information is there. I mean, you can obviously put MMR and autism into Google and find some atrocious information or information that's inaccurate. So there are some pediatricians, there's a peds GI doc, Dr. Vardabedian and Dr. Gwen, and they say it's part of being a good, thorough pediatrician to be present on social media to ensure that the information's accurate. How many agree with that statement? Some do. Okay. So you can cure cancer with social media, or at least fight cancer. This is somebody who's trying to who's sharing information, and even the CDC is on Facebook. What are they trying to do? They're trying to reinforce messages. They're trying to reach new audiences. And social media can be a part of the Office Toolkit. This was from the AAP News. This is where some of the discussion was generated about an ethical obligation for pediatricians to be online. But really, you can explore all possible ways to communicate with your patients. You could advertise your wait times. This emergency room out in LA tweets their emergency room waiting times, so the public knows how long they will have to wait. Your practice could set up a blog, right? Genesis Pediatrics in Rochester where they were inundated with phone calls about H1N1, and in response, they used social media to manage the information. They created this blog and a Facebook account and a Twitter account. But you don't have to go to Rochester. Tacoma Park Pediatrics. Anyone in the room owner of this blog? Okay. So you're in the audience. You could set a Twitter site up for your practice as well. You could put, or could you put, anticipatory guidance on YouTube? There was an article in Healthcare Informatics last year that said that hospitals and healthcare systems are utilizing these tools to improve staff communication, to recruit for research, to facilitate networking, and to build the hospital's brand. There's, how many of you read AAP Grand Rounds on paper, online? So, you know, it's available in multiple formats, but our very own Bud Wiederman from Children's has a blog on AAP Grand Rounds. It's called Evidence Emended, so you can blog about PICO questions, and Bud's found a way to do that, Dr. Wiederman. And so essentially, I didn't mean to make you so worried and you do have some control, right? You can monitor your digital footprint. How many people have Googled themselves? Lots of people have Googled themselves. Okay, so you can set up a Google alert so you know when you are written about online, when something comes up about you. Anyone have a Google alert set up for themselves? Some people? Okay. And then you'll be notified by whatever method you choose. I mean, someone from Google won't come knock on your door, but they can let you know when you've been talked about online. You can untag or delete or try to purge. So you can, untagging is removing your name's association from a picture that you don't like or you don't want up there. You can also, and this will probably be the most important thing you can do, is you can help your patients act responsibly online and steer them towards reliable health information even within social media. This is from Archives, and it's some information sheets for your patients, but there are also guides about what questions to even ask. It just came to my attention that June is Internet Safety Month, and it also just came to my attention that Monday in the New York Times there was an article about stupid things that teenagers are doing online. I mean, that was actually the headline. It's not my judgment, but I would have made that judgment anyway. They have been doing fire tricks where there was an emergency room in New Jersey where they were seeing some burn patients, and it wasn't the run-of-the-mill bad burn, but looking into it a little further, teenager would wear some protective clothing and then put these fireworks in the family bathtub, set up a video camera, hoping to put this on YouTube, the video sharing site, and then sustained massive burns. And so stupid things that are going on online, indeed. So there's, this is on the AAP website, talking to kids and teens about social media and about sexting. So even just starting off with the question, have you used the computer and internet today? Even if you don't know which is going to be the latest thing, Dig or Delicious, that they're using, you don't even have to know the names, but just opening up the dialogue, especially since all of these unhealthy things can be happening. This is also from the AAP, and it speaks to cyberbullying. So we all know that bullying takes place in offline, but it's also happening when people use computers or cell phones or other devices to hurt or embarrass another person. So what could you tell them? I mean, you could say not to participate. You're going to empower them to tell their friends to stop, to block communication. Some of these suggestions. You can also, there is the YouTube, the G-rated edition, and so you could encourage your families, the parents, to, if they're going to use YouTube, to put it in the safe mode, and it's demonstrated here how you can do that. You don't have to be logged in or have some special sign-in. It's just there. You just check on, or you can check off. My son likes music. 3 years old, and you can't search on YouTube to show him a music video of like the Bare Naked Ladies. It's just not going to happen. I don't know if you're familiar with that group, but anyway. But we can do the Beatles. So remember, you can use the web to inspire and educate and innovate, but that professional and personal could be merged, right? And so you have to be careful about that. And, you know, like at the end of this book, who's familiar with this book? Everyone knows this book. Okay, good. I mean, have you read it this week, though, is really what I want to know. Or how many times? So what's the last question in this book? Anyone remember? Yeah, would you tell your mother? Right. So what would you do if your mother asked you? And so, you know, what would you do if your patients friend you? So, you know, what are those options? Are you going to ignore? Are you going to accept? Or are you going to actively decline? But then would that just lead to a discussion? I mean, that would be the best thing. Whichever of those three choices that you do, ignore, accept, or request, or decline, you know, you might want to just discuss with the patients and families. You know, it may be a teen patient, it may be the parents of some patients, and how, you know, it's great that they want to be more connected to you, and then you can talk about what ways you feel comfortable being more connected to them. And so these are some of the references that I've mentioned during this discussion today so far. If you're like me, you still read some old-fashioned journal articles, right? But when you do the kind of research I do, you get to read articles like this: take 2 aspirin and tweet me in the morning, how Twitter, Facebook, and other social media are reshaping healthcare. This was in Health Affairs last year. And so some take-home messages. This is what it would look like on Twitter. Be familiar with those tools. And be familiar with what your patients and parents and peers and those you're educating are doing. And then you can experiment, but do so cautiously, and, you know, have your professional guard up at all times. And you can consider using social media for good causes like advocacy or education, to have information that you feel comfortable there, crowding out the bad information. And so I just want to thank Mark and everybody for having me here, despite my off-topic topic. And if you want to put down your texting devices, you're welcome to ask me questions.
When you asked us about whether we're on Facebook, you didn't differentiate between, are we on Facebook professionally or are we on Facebook socially?
Good, okay.
Okay.
Yes.
So can I see whose offices are on Facebook?
So whose office is on Facebook?
Whose office as opposed? So we got 2 people. Twitter, anybody tweets for their office? Okay. So we're still not, we're so.
And I'm glad you bring that up, because, you know, when I did just say you, that's part of it.
Yes,
you know,
what is you?
Right.
And we're at a professional meeting. I was thinking Children First Pediatrics, which is not on Facebook, but Cindy Fishman is on Facebook. So,
okay. But it could have been either
one. Very careful
one.
about who she friends and does not friend.
So what I'd like to ask for the practices who raise their hands and saying they're on Facebook, I think other practitioners would like to know, so who's doing that? I mean, who in your practice is actually monitoring and responding and doing that kind of work, and how is that disseminated to the families, and sort of what's the response? So I'm just sort of we have a couple minutes for discussion. I think folks want to know. So
well, I was gonna, as the other person who has mentioned that they friend patients, of note, you know, we've set some very strict guidelines on this because they're close family friends who happen to be patients. So, you know, since we do have a practice site, we're able to, you know, when I do get friended, it's more of a comment at this point, but I'll comment in a second. If I get friended by a patient who is not my next door neighbor, then, you know, you can message them directly and say, I think this is slightly inappropriate, I don't want you to see pictures of us on vacation, and refer them to the practice site so that they can still be socially networked in, they can be part of the group, but not outright rejected. So, because you can lose patients that way very easily if you just ignore them and then they message you and say, well, what was the deal? We publish, we just started with Facebook. We have our logo and our hours and our location and MapQuest and links and things like that. But we also are able to post notes and, little updates and things like that. If I'm out pulling ivy down and realize that it's been half an hour and I'm not wearing gloves, and it occurred to me that, poison ivy's popping up, and that's something that, I'm obviously not thinking about and other people should. So I can go in and just fire off a note with a knowledgeable discussion of poison ivy, and it just goes out. So we're advertising in the office, go to this site, and I'm updating it periodically. And,
So it's inter-office communication as well? I mean, that's the intention
well,
as well as
it's actually blocked in my office, so I have to, get on it.
It's blocked in your office?
Well, because we don't want people playing on Facebook when they should be seeing patients. But
no, absolutely. It's something interesting to think about if you want to use one of these tools, like at Children's National, who, as I started with, has all these sites. It's blocked from on campus.
Well, the biggest thing, and we have a network EMR, is that a lot of these things carry viruses. A lot of the Facebook, Twitter, et cetera, carry viruses, and they've been banned by our IT people because you can't, if you open up the wrong thing or friend the wrong thing or get a video on the wrong thing, you don't even have to necessarily open it. It just has to be on your page, and you can infect the whole system with some virus. And so our IT people have actively canned it. And so, I'd be surprised if Children's didn't block it too. In fact, I'm pretty sure they do.
They do block it, right.
Yeah, I mean, any major network site has to block those. There's no way to safeguard yourselves from those kinds of viruses at this point.
Yeah, I would just, and I do want to invite some of the other practices. Two things. One, I think at the hospital, I think there are two reasons for blocking things. One is, I suppose, the concern about security and viruses and those kinds of things. The biggest reason, I think, actually is employee distraction. That everyone will be on there. Interesting, a couple months ago, there was just an article about the Pentagon deciding about whether or not, they should open up to social media sites, because historically the Pentagon had been sort of shut down, locked down for same sort of reasons. And they actually made a decision at the Pentagon to open it up, in part because in the military, so many people are deployed around the world that within the military and their families, they're really using this media to communicate all around the world. And so they decided that they could manage the security risks differently and made a decision to open it up. But I want to get back to our pediatric practices.
But also the potential for breaching patient confidentiality goes way up when you have everybody there who can just say, just saw A, or the disinhibition and the ease of access would open that up.
Guess what STD Susie has?
Well,
like,
yeah. In room, whatever. Yeah.
Can we get a couple other perspectives just from other practices that are
like
using Facebook as a public?
Yeah, and who's doing it? Is it the doc or?
Yeah, I'm not doing the Facebook because the few reasons. First of all, the HIPAA. Second of all, you never know what kind of viruses you get through it. And my opinion, if you want to communicate, you always can set up emails and to put all the information on your website. Just get a good website, interactive website, and you're set. Because I don't think Facebook really appropriate for professional practice.
And would you have, you can have a lot more control if you set it up, and then would you have responses or input from the public or from your patients on such a website?
You definitely can. Yeah, you definitely can have a nice interactive website if you set it right, and it'll be private. And I mean, with all these HIPAA regulations, and my concern that you really exposed if you go to Facebook or Twitter, and you really don't want to do that. That's my perspective.
Okay. Thank you. Yeah. interactive website with the blog, and what we realized is that you're kind of reliant on the patients to come to your website and check it, whereas with Facebook, you can just post something and it's on their news feed once they friend you. So they're constantly getting messages from you without them having to do the work even. So we can post pictures of events that we have, or just health messages, and I think it's so much easier. I mean, our patients are definitely using this, and even texting. We haven't done that yet, but I think there have been studies to show that practices are even texting their patients regarding their appointments and things like that.
Did you have some ground rules set up within the office?
Well, we just started with
public?
the Facebook, so we're kind of exploring, how to handle all of that. But we have an office manager who is the administrator as well as myself, and we, check the page every day. We really don't have any friends besides us two right now, so we're going to advertise it at the practice. Yeah. But I think the key benefit is just that, whereas with the website, you have to, you tell your patients about the website. It's up to them to constantly check it for that updated news, which they may not do. Whereas with Facebook, it will be on their news feed. So they will be getting information about your practice, even if it's not in their mind.
Mm-hmm. Mm-hmm. Yes. Mm-hmm. And that was on your practice's Facebook page? Mm-hmm. Okay, that was similar to this one. Mm-hmm. Okay.
Did everyone hear that?
No. The impetus for their practice setting up the Facebook site was to share information about whether the H1N1 vaccine was in yet or not, because patients and families were calling every day to check, and so that really helped their practice. Yes.
So I have a question off this topic into what you're talking about. My sense is that there's always been stupidity in the world, and there will always be stupidity in the world. But before, it was amongst your small group of friends. So the sense I can't understand is it more because they can reach more people, or is it the same amount of harassment and stupidity? It's just now on a grander scale.
Yeah, that's a great question. And even with the fire tricks or the fireworks YouTube videos and stuff, if you search fire tricks, I think you get 100 videos. No one's claiming that it's happening more often, but it is shared publicly. But it makes me think also about this online professionalism and what we do. When we were in medical school or residency, maybe we had an end of the year skit that we made fun of everybody, or we joked about things, and that skit in the past was never online for the world to see, and nowadays it's absolutely online, whether it's officially done so or just someone has a little camera and puts up that clip. And so so then you can really ask the question, is it unprofessional behavior if it happens, or is it unprofessional behavior if it happens and is seen by other people, right? So that's really what we have to think about, for any behaviors. So I'm raising more questions than I'm answering, but that's okay.
I think we have time for these last two comments, and then we'll sort of break for lunch. But
We're on Facebook because old people like me don't do too much about Facebook, but the younger pediatricians in my practice thought Facebook would be a good idea. So we discussed it, and we have an HIT person in our office, and one of the director of nursing is very interested in this, and then we assigned it to one of our nurses who runs this down at our Lake Ridge office. So we had kind of control on it. And then we had a report back. So the only thing I can give you, it's secure and it's safe because they put those things in there, and I don't know anything about how they did it. Second thing is, I'm not interested. The second thing was that we were getting just pictures of kids. This is what my little Alfred looks like under your good care. So you get a lot of feedback from your patients. Our thoughts of using it in the beginning was that once we get a lot of friends on there, if you want to hit people right away, like when the thing came out about Motrin and Tylenol, you can immediately put that out to all the people on Facebook, and then you have it on your website. And we have a patient portal, but it really, Facebook will just give us all the Facebook friends get notified immediately. That was our reason.
Yeah, thank you for sharing that. On Twitter, a lot of people do retweeting, which is retweeting the article about the recall, or the information about whatever you need to convey. Yes.
Hi, I'm Elisa Petter. I'm a former children's resident, and I actually write the Children's Health and Wellness blog for Tacoma Park Pediatrics. And I think two ways that a blog and a posting from a pediatrician can be helpful is advocacy and then also anticipatory guidance. What I was able to do, and we just started this maybe 2-3 months ago, is really make anticipatory guidance specific to our patient population. So we're seeing a lot of obese patients, and we started an obesity initiative, so some of the postings are related to that. Other postings, are in timely manner to talk about summer safety and sunscreen, so I think you can make it specific to your patient population. And for the patients that are using internet, they are actually looking up, who their doctor is and what kind of information they can find out about you. So for the ones that have come and seen me there, are actually reading the blog. They might not be following it, on the website, but are reading it. And I think another way is really it's can be used as a tool for advocacy, like for Children's Mental Health Day. I posted information about it. So I think, it's networking, it's sharing the information, but it can be used in a positive way. And the way that we have actually, imposed some security regulation on it is that we have an email address, Ask a Pediatrician. So it's not like you're constantly getting text messages, but that way you can, have your patients email you if they have specific questions regarding your post.
Thank you. Thanks, everyone.